Welcome to the Global Communiques In-Depth Conversations. Today we are joined by Chavis Jones and Mary Ononokpono, who will both give us a socio-political and a historical lens into the intersection of race and socio-economic status and its impact on COVID-19 in the UK and the US respectively. I will introduce them both. So Chavis Jones is from the United States. He graduated from Morehouse College, where he studied philosophy. Chavis then obtained a Master's of Divinity concentrating in religion and social ethics from Harvard University. At Harvard, he was a fellow of the Harvard Graduate School Leadership Institute, a staff writer for the Harvard Journal of Human Rights Policy, and a ministry fellow. Chavis also graduated from Duke Law School, where he focused primarily on civil and human rights issues. He was the president of the Duke Black Graduate and Professional Students Association and worked as an active investigations team member of the Duke Law Innocence Project. Thanks for joining us, Chavis.
Thank you.
We also have Mary Ononokpono. Mary is an award-winning writer, artist, and illustrator from the UK. She has authored literary fiction, including children's books. In 2014, she won the Golden Baobab Prize for Early Chapter Books. And in 2017, she won the short story Is Dead, Long Live the Short Story Prize for her story titled Firewater. Mary was born in Calabar, Nigeria, and holds a history degree from SOAS, University of London, as well as an MPhil from the University of Cambridge with distinction. Mary is also a PhD candidate in the Faculty of History at the University of Cambridge, currently on sabbatical. Thanks for joining us, Mary.
Thank you very much for having me.
So COVID-19 has upended normalcy for the whole world, whether you speak of businesses, governments, or individuals. As of earlier today, the 29th of May 2020, there are over 5.8 million confirmed cases worldwide and over 361 global deaths. The figures are fluid and subject to change, obviously. One thing is clear, the novel coronavirus does not discriminate. In previous months, reports came in of celebrities having been infected, government officials also infected, as well as ordinary individuals. COVID-19, however, has laid bare the underlying structural inequalities that precede the virus itself. The UK and the US have both reported the disproportionate numbers in which Black and Brown and ethnic minority communities have been affected by the virus. So to kick things off, guys, I'll start with an open-ended question, and I'll start with you, Mary. Can you tell us why this pandemic has exacerbated inequalities in the UK and what has been observed there?
As you said, it's predominantly Black minority ethnic people who are dying, not just coming down with the disease, but dying in large numbers. And I think basically it just shows up structural inequalities, health inequalities. Not only that, but many on the front line, key workers, they are Black and minority ethnic. So yeah, you've got high numbers of Black people, Asian people working within the NHS. They've not had the correct protective equipment. Yeah, they're literally on the front lines. Likewise, like you find similar things when it comes to supermarkets, delivery drivers, everything that we need to keep the country functioning on some level. You will find Black and Asian people in large numbers, not just Black and Asian people, but Eastern Europeans, people from historically disadvantaged communities. And then what we're finding is, I mean, like many people from such communities have underlying health issues as well. This is a consequence of structural inequality, of poverty. Like, you know, if you're poor, you can't afford to eat healthily.
Right.
Unhealthy food is often cheaper. Like you're either not working or you're working in a high stress job. Like before COVID-19, so many of us were dying of stress related diseases over here anyway. We're finding like large numbers of young people from such backgrounds as well, dying of this disease, and it's for similar reasons. I've lost friends, elders. It's wild, and we're not seeing the same impact on wealthy or white communities. I think this is something that you'll find in the States as well, not just in the States, but in Europe. Like basically, it's just throwing structural inequality into relief. Yeah. My parents, they're both in their They're in their 60s and 70s. They're working on the front line, health workers, key workers. My dad's a pharmacist. They've both got doctorates, but they're having to work when they should be retired through a pandemic. And like within my circles, I think you find similar things with many of my peers, their parents, many doctors and nurses. Yeah, they're on the front lines without the correct equipment. I just think it's shocking, actually. It's shocking. The government should be doing more than it's doing. I think there have been mixed messages from the UK government, from Boris Johnson, just even one of his chief aides breaking the lockdown. Seems to be one rule for some people, another rule for others. It's the poor who are suffering, it's the poor who are dying, and the poor are predominantly Black, Asian, and minority ethnic. This is what we're finding. This is not surprising to me at all.
Let me pivot to Chavis. So Chavis, based on what Mary has said and from your own experience in the US, what are your observations there? The disproportionate numbers and percentages of COVID-19 deaths among Black and Brown communities. What are your reflections on this?
So I can absolutely echo many of the sentiments that Mary has laid out in terms of how this looks on the part of the states. When we think about these conditions, these underlying conditions, I think about it in two ways. We think about the social determinants of health, where a person lives, where they work, and the access to healthcare that they may have. African Americans and Black people writ large in American soil are disproportionately susceptible to having these type of comorbidities, the issues that underlie a person being more likely to have COVID-19 or more likely to succumb to COVID-19 via death, as it were. And so I think about this quite a bit in terms of the intersecting realities of African Americans in many senses being disproportionately impoverished, disproportionately likely to have healthcare issues related to their bodies, and disproportionately individuals who live in environments where there are really high numbers of COVID-19 related deaths and illnesses. And so I think these are the things we have to consider. And I think the underlying condition that we really need to speak to is systemic racism. And I think that's something that Mary has alluded to quite a bit there. And it's the same issue in the US in terms of this nation having a pre-existing condition of consistently and endemically leading to African Americans or anyone who is Black on this soil being less likely to have the requisite things they need in order to have life at liberty and to pursue happiness. And so as it relates to healthcare, I know as a Black man living in the South that people are more susceptible to having hypertension and high blood pressure and diabetes and pulmonary conditions, all of these things that are a condition of people who are disproportionately poor and who have an outsized level of individuals who are in a system who aren't trusting of the healthcare system. Many African Americans don't trust healthcare workers because of centuries even of conditions where individuals didn't feel that they were receiving adequate treatment for the types of illnesses they were succumbing to. And so there's a lot of systemic inequality that we have to deal with here. But I don't think it surprised anyone that Black individuals in America would have been those who were most susceptible to these conditions. And so it's played out just as many people who have done this research on public health anticipated over time. They anticipated individuals who are minorities, particularly Black people, being most likely to succumb to COVID-19. And that's the way it's played out. And in addition to what we'll discuss later as a crisis of leadership in this moment, that's exacerbated these issues.
Absolutely.
Yeah. So the US and the UK may arguably be similar in some ways, and both of you have seemed to echoed one another's sentiments in many ways, but they're also quite different in terms of the healthcare service in both countries. The UK has a national health service that is more of a public sector system. So you'd arguably think access and affordability would be easier for Black and minority ethnic communities, while the US, on the other hand, has a private sector system with health plans and individuals having to pay out of pocket expenses. So there, of course, access and affordability would be an issue for those that are at this lower socioeconomic ladder. So Mary, what is somewhat interesting for this, what you said right now, with the National Health Service, which provides healthcare to everyone in the UK. The UK is still experiencing disproportionate numbers in how COVID-19 is affecting the Black and minority ethnic communities. Why is this?
First of all, the political reasons for this. We've had a decade of a conservative government, first conservative and liberal Democrat, and now just outright conservative. We've had a decade of underfunding the NHS, a decade of politicians looking to privatize the health sector. So it's been massively underfunded. Doctors, nurses, healthcare professionals are overworked and underpaid. They don't even have the basic equipment they need. There's been a shortage of ventilators. Thankfully, it doesn't seem so far. I don't think the situation has been as bad as was predicted at the beginning. So they've not had to bring in ventilators from elsewhere, etc. But why don't they have enough ventilators? Like just basic equipment, why is that not there? It's because there's historic underfunding. There have been so many calls to privatize the NHS. When you look at it in major cities in the UK, NHS workers are predominantly Black and Asian. So they are the pillar of the NHS. Without Africans, Caribbeans, the Windrush generation, and South Asian people, there would be no NHS in cities like London, Manchester, even Cambridge,
The medical staff within the NHS, the first 4 doctors to die from COVID-19 happened to be Africans, actually.
Right? Yeah. I think in order to dissect this properly, we need to have a much broader and deeper conversation. There are trends that have been apparent just for many decades, actually. There's no NHS. The NHS was actually created, so after the Second World War, so many young British men died. When it was created, there was a labour shortage in this country. And this is where you see the Windrush generation, Caribbean people who came over to plug gaps in the workforce. When they came over, they expected to be treated like human beings, and they weren't, basically. Later on, you have waves of African migrants coming over to the UK. And there are historic reasons for this, but they're predominantly working in the sciences, in healthcare. They come over at the onset of the African crisis period. Doctors, professors, many of them can't find work. They're taxiing. There's just like racism so deeply embedded within the fabric of this country. Can't come over here, can't find work, befitting of their stations. So there are generations of us here who've been impoverished, basically, like only just beginning to come out of it now. Of course, we have these pre-existing health conditions en masse. It's very frustrating. This is something we don't talk about in the UK at all. Like we're always quick to point the finger at America. Look at America's racism, this, that, and the other. Even in the last couple of days with George Floyd. But I don't know, racism is thick in this country, and it's invisible. It's also highly visible as well.
Yeah. To Chavis. So Chavis, can you give us an outlook of how racial disparities interface with the US's kind of healthcare system, and what we are seeing with COVID-19's outcomes on Black and brown people in the US, where access and affordability is a problem in a healthcare system that is highly privatized?
Mm-hmm. In America, it's very clear that there's a huge chasm between the proportion of the population who are white and have access to private health insurance. It's about 75% in 2017, according to the U.S. Center for Health and Human Services, as opposed to about 55% of African Americans who have privatized insurance. And so we also find that about 44% in that same year in 2017, once again, according to the U.S. Department of Health and Human Services, about 44% relied on Medicaid, so publicly sourced health insurance, and about 10% go uninsured. And so this is all data from an article that you sent, Mary Jean. We really appreciate you for that. And so those are eye-popping disparities in terms of the percentage of individuals who are relying on the state to supply these needs. But in terms of the social memory with African Americans and the culture around health insurance, so many people would rather go untreated or rather not visit a doctor than have the exorbitant amounts of costs that they incur as a result of going to doctors within the Black community. And so that's been a major part of my experience growing up in the South, hearing about individuals who had illnesses untreated until the very end, when they finally realized that these things were terminal. And so it really causes a lot of issues within the African American community. Health insurance is very expensive. We had President Obama who instituted Affordable Care Act that was very beneficial to many minorities, especially those who have pre-existing conditions. And then you've had a regime of individuals who have sought to peel back the layers of those types of social interventions. And so this disproportionately, once again, affects African Americans who have these pre-existing conditions, who by virtue of their lineage are more likely to have a high blood pressure and the like because they've inherited it. Go ahead.
I'm also thinking about geography, like where people live, locations. What's the situation in the States? Because I know in London, for example, London's a very densely packed, densely populated city. It's a relatively small city, and so many people live there. Black and minority ethnic people, actually. Yeah, so I'm just wondering, like, what's the makeup in the States? Like, are Black people living in more densely populated areas, or like what does it look like over there?
I think that's a question that varies from state to state. If you're thinking about in New York, absolutely, in very densely populated areas, if we overlay or intersect with the issues of poverty, of course, individuals are more likely to live in projects, as they're called in America, or ghettos, where individuals are kind of smashed into communities, living on top of one another. But the same issues go across the board for individuals who live in more rural areas. The same issues pop up in places like Louisiana, where they're 33% of the population in terms of African Americans, but more than 70% of the COVID-19 cases. Individuals in New York are twice as likely to have COVID-19 if they are Black than if they are white. And so it really, whether you're in a sparsely populated area or a densely populated area, many of us living in the South, in the Midwest, in cities like Chicago and Detroit, wherever you are, if you're in Chicago, Detroit, New York, or you're in a small city in South Carolina, North Carolina, the likelihood that you have COVID-19 is higher than a white individual, than a white counterpart who may be similarly situated in terms of wealth and social location in terms of where they live.
So that's just structural racism then.
Absolutely.
And the US is quite polarized at the moment, with on many fronts, so including with regards to racial inequity. So whether you think about COVID-19 and its racialized makeup and the disproportionate numbers of deaths among Black and minority ethnic communities, but how does this factor into movements like the Black Lives Matter movement and what we're seeing, as we spoke earlier, in places like Minneapolis, where there's discontent on the deaths of the death of people like George Floyd and things like that. So how does this intersect with a system that already has people quite at unease with racial issues in the United States?
So when this pandemic started, I was still a student in law school. I just graduated a few weeks back. And so on a university campus, we were having these conversations, and I think the sense of isolation was piercing because many individuals were not around their peers anymore. And I think that goes for people across the board who are at home and dealing with these issues. When Ahmaud Arbery, the individual who was killed in Brunswick, Georgia, in February, and it took 2 months for his killers to come to justice, and we're still in that process with them. I think many African Americans were disheartened because we couldn't believe that everyone in America was quarantined, but racism wasn't. Racism was not quarantined. It was still on the run. It was still running rampant, and it was breathing easy. And so in situations like this, where individuals have back-to-back issues with a Breonna Taylor, with an Ahmaud Arbery, with a George Floyd, and countless other unnamed individuals who haven't come to light yet, it has a huge impact on the mental health and well-being of African Americans in America, who have to not only confront a pandemic that's potentially deadly, but racism that is deadly.
It's
And
deadly.
so we're dealing with both of these realities, all while quarantined, all while sitting in my apartment, thinking about these issues consistently. I have to wear a mask when I go out, but I also have to worry about individuals who may see me as a threat by virtue of my skin color. And so these issues have been exacerbated, I think. There was kind of a resting lull prior to this where individuals weren't thinking about kind of the state violence that's exacted against African Americans. But as soon as this started, it seems as if when society kind of went on pause, there was a press play on racism, and in a great way where people had to deal with this every time you turn on CNN or MSNBC and any of the other outlets where you watch the news, even the places where you go to get your weather, you're going to be confronted with stories about George Floyd and how individuals have responded to it. And these decades and centuries even of racist structures that have definitely disproportionately affected African Americans.
And Mary, on the socioeconomic front, you mentioned this earlier as well, with quite overrepresentation of Black and minority ethnic communities in essential services. So shop attendants, bus drivers, carers, even doctors and nurses that are on the front lines. And yet there's still this vulnerability with the same demographic when it comes to COVID-19. And similarly as well with a sense of not really appreciating people of this demographic under normal circumstances, but then now with this sense of urgency, there's this need to now clap hands for the NHS at certain times of the day in the UK. But before that, there was this sense of, oh, people should go back to their countries. Even with the Windrush, for example, are certain people that had come to plug in to certain workforces in the UK. What can you say about this and just your reflections generally about appreciation when it comes to this particular demographic and their expertise in essential services in the UK?
I don't think any health workers need appreciation right now. This same Conservative government a couple of years ago was objecting to pay rises for nurses, for example. Like, why are you clapping for people? It's so hypocritical. Instead of clapping for people, pay them what they're due, Just in terms of like this Windrush issue, for example, this has been happening to Black Britons for decades. Like my family, we had immigration issues when I was small, basically. Like, can you imagine households headed up by 2 doctors, Africans, Nigerians, and just couldn't find work. They were cleaning, taxiing, doing all sorts. Like, what does that do to a family, people spitting on you? Things like this have been happening for decades. Like, even the whole Windrush issue, Theresa May, just the boss that said, go home, I can't remember the exact words, that just transported me back to my childhood in inner city England at the height of Thatcherism. There's nothing new here. Like, the more things change, the more they stay the same. I'm just listening to just the plight of African Americans, and I'm just thinking, this is not just in America. I know in America it's particularly bad. It's awful here as well, not in the same degree. People aren't dying in those kind of numbers. But I was even thinking about what was happening in China a few weeks ago. China, the epicenter of this outbreak, and the way Africans were being treated there. Like, even in Cambridge here, I've come out of my flat and Chinese people are giving me the wide berth. Why are you giving me the wide berth? Do I have coronavirus? All over the world, Black people are facing similar issues, like being scapegoated, like having to navigate impoverishment with this. Do you know how many people have been laid off? Not just in the UK, but everywhere. Basically, the people who are being laid off predominantly, I think if we start to examine it, we'll find that they're predominantly Black and minority ethnic again. These are people in precarious positions. There's no job security, nothing like that. Like, people are struggling to feed their families now. I just think there's a lot of selfishness as well going on. I'm seeing people going to the beach, things like that. And if you've got relatives who work on the front line, all they want is for people to stay home. But when you're looking at who's at the beach, it's not black and minority ethnic people, it's wealthy white people.
What I found quite interesting, like you mentioned now with Africans in Guangzhou and how they were treated badly, and people thinking that they're bringing the coronavirus by virtue of just being black. But at the same time, there were many videos I saw also of many Chinese Americans in the US, particularly, that I saw that had also been receiving discrimination just because,
Yeah.
Chinese American or Asian American, and people just discriminating against them because of coronavirus and the origins of the virus being from China. Pivoting to you, Chavis, when it comes to leaders that are referring to the virus in particular ways, how does this add up and make it even more worse for people of a particular demographic, whether you're talking about Black people or talking about people of Chinese origin, and how they're treated and how leaders respond to the virus? As what have you been seeing there?
Yeah, so I think, once again, echoing much of what Mary has said here, I think that this crisis of leadership that we have, where we have leaders at the very top who are referring to this virus as the Chinese virus, not giving any credence to the very medical terms that have been instituted by those who know much more about the virus and its nature. We all know now that we call it COVID-19, and we refer to it as the coronavirus. When these situations happen where individuals use stereotypes to incite fear, it gives individuals who already have these types of pre-existing biases, it gives them license to treat those individuals worse. When you voted for an individual who you respect for whatever reason, or you regard as a person who's worthy of governing, and they put out messaging that leads to individuals being called thugs, as has been referenced today in America with Minneapolis, and those who have been rioting, they've been referred to as thugs. When those same types of leaders call individuals who are crossing the border into America rapists and thugs and murderers, when those same types of leaders refer to this virus as a Chinese virus, they know what they're doing, and it's a dog whistle to individuals across this country who have not filtered out the very racist ideas that have permeated this country since its very origins. And so when we have leaders like this, when we have a crisis of leadership like this, it can be deadly for individuals who are in vulnerable populations, who might be on the margins of society, who might be disproportionately susceptible to issues of racism and classism. And that would be minorities in many senses. And so I think that this is a time where we really, really have to point to our leaders and say, be true to what America put on paper with regard to equality for all. And we have to be much, much more damning of leaders who refuse to operate in a language that is inclusive, or in a language that that yields to the fact that we're all supposed to be on an even playing field with regard to race, and irrespective of our station in life. And so once again, we have a crisis of leadership.
Can I ask you a question, actually? Just going off the back of that, did you notice any differences in the way American leaders were handling this crisis before they understood who it was killing, and after?
Absolutely, absolutely. So initially, this was an issue that everyone suspected was affecting the elderly and a particular demographic, and the numbers weren't known in terms of how it was affecting minorities. Soon after those numbers started to be released, you started to see leaders in places like Georgia with Governor Brian Kemp, who said that we're going to roll back these controls about quarantining, and we're going to release the population to re-enter spaces like salons and beauty parlors and places that minorities frequent. And so I think there's a great disregard for the life and prosperity of African-American individuals, but not only us, as you mentioned earlier, Chinese individuals and others, because this issue is not affecting people in the majority population, white people, to the extent that it's definitely affecting African Americans and other minorities. And so I definitely saw that. I saw changes in the way that pundits were discussing this issue. I saw changes in the way that articles and opinion pieces were being pushed out. But what I was really heartened by was the immediate awareness by those who are socially acute, who understand these issues, to push back against this. But I think what we saw, first of all, was that across the South, which is, has a great proportion of America's African American population, across the South, we saw states immediately starting to roll back the quarantine in terms of how they were going to sanction people to stay inside. And so it's led to an uptick in the death toll and an uptick in the number of individuals who have contracted the virus.
Mary, in the UK, it seems like there was a bit of a hesitation to acknowledge the fact that COVID-19 was disproportionately affecting Black and minority ethnic communities in the beginning amongst the leadership. Why do you think that was the case?
I just think it's the current government. It's a conservative government. I don't even think it was just a hesitation to acknowledge that this thing is killing Black and minority ethnic people disproportionately. I think there was a hesitation to acknowledge that it's serious in the first place. Yeah, when the news first started coming out of Wuhan, it wasn't being taken seriously. Yeah, I'm just thinking back to February now. So my daughter went on half term during February. A bunch of kids from her school went skiing in northern Italy, came back, and we were asking each other, why are these people not quarantined? Italy was a hotbed for the virus at that point. It was like, I think very shortly after that, Italy went into full lockdown. But the government dragged their feet until near the end of March. And I just think this government, Boris Johnson, let me just name him, he's been agitating for Brexit, for Britain leaving the European Union. I'm just even wondering what impact this has on those negotiations. I think it's looking more likely that we're actually going to leave without a deal. They've just been agitating for Brexit. They had no other agenda apart from Brexit coming in. It was all get Brexit done in the last election. Even before that, in the last 3 years, the initial debate around whether we remain in the EU or whether we leave the EU, Boris Johnson and the people around him, they've been agitating for Brexit since 2016. They weren't prepared. They weren't prepared for anything else. They didn't care about anything else. It caught them unawares. Even now, this government has not been accountable at all. This is not even to mention that this is affecting Black and minority ethnic people disproportionately. Brexit is a racist endeavor, deeply so. All the dialogue, the discourse around it was go home, not just to Europeans, EU members. But I just remember the day after the Brexit vote, seeing graffiti like on bus stops, go home. This is the sort of stuff that I saw when I was a child in Thatcher's Britain. So I just, of course they're going to hesitate. Of course they're not going to take it seriously. This government has proven time and time again that they're not champions for diversity, basically.
Chavis, when it comes to the Black Lives Matter movement in the US, how do you think now with COVID-19 and its effects on Black and Brown communities in the US, what do you think its effects will have on the movement itself?
I really appreciate this question for many reasons, because I've been a student of the civil rights movement and thinking about how it is that individuals were able to gain allies across lines of race and difference back in the 50s at the very start and inception of the civil rights movement. And so one of the things about society at that time was there was only 2 to 3 television stations that everyone was required to watch. TV was a very novel thing. And so everyone saw what was happening in Alabama when Dr. King and others were leading the civil rights movement, and children were having hoses sprayed against them, and dogs were biting individuals. And it caused a great crisis for America, for people living outside of the South, because they finally realized that they had to do something about it. One of the unique aspects of this particular moment that we're in is that we're all quarantined. We're all required to be still to a certain extent. And so in America, people are now forced to look at their social media, to watch television, and to be in environments where they're consistently confronted with the reality that Black people in America, in terms of their lives, are not deemed as valuable. And so for a movement that started in 2014, and prior, with the death of Michael Brown and Ferguson, that kind of has hit some some ebbs and flows at times in terms of its peaks and its valleys and popularity and involvement. This is a moment where many people need to acknowledge the fact that we still face issues of race and of a state that has sanctioned violence against Black people. So I think for that very reason, you'll see people become more invested in this issue. Not only that, but this is an election year in America. And so from a social engagement perspective and from a political engagement perspective, those two things are one in this moment, where to be socially involved with issues of race and those matters also directly has an impact on how individuals will vote when November comes, how individuals will see political figures with regard to how they're speaking out for these issues, and the degree of social activism that individuals are feeling from their couches, where people feel inclined to be engaged in movement activism from their social media account because they can't be silent. And honestly, African Americans, to a large extent, in terms of my friends and people that I'm close to, are tired. They're tired and they're fed up of these situations. And that was the situation that led to the coalescing around the civil rights movement in 1955, when Emmett Till was killed in Money, Mississippi, where a young man was minding his own business and was accused of whistling at a white woman. And so from that point to now, 65 years later, we're still seeing issues of unmerited death and violence perpetrated against African Americans, where people are saying, I'm tired. And if this can happen to individuals, however they're situated in society, if just because they have Black skin, it can also happen to me. And there's a great consciousness around that brewing among African Americans and others who deem themselves allies. When Ahmaud Arbery died, and this is the last point I'll make on this, people all over America walked 2.23 miles and ran 2.23 miles in honor of his legacy and the day in which he was killed. And I think in that moment, I went out to do a walk myself by myself. And for the first time in my life, I realized how often I had taken for granted the freedom of exercising and running and going out as a Black man. And then it started to rain, and I put a hood on to prevent the rain. I was reminded of Trayvon Martin from many years ago, and how little we've come socially, how far we have to go socially in order to get to a place where African Americans feel that they're safe and that their humanity is honored, in a society where it seems that we place profits over people, and the lives of Black people in America have been deemed less valuable than anyone else's.
Wow. And what do you think the effects this will have on, the election season come November in America?
That's a very nuanced question, because I think there's a great deal of dissatisfaction with both political parties as it relates to African Americans and our feelings of being heard with Republicans and Democrats. So it's a nuanced question. I think one of the targets has been, though, to ensure that both for the presidential race and others across the states, that individuals are actually engaged. People care a lot about this election. And I think that in 2016, many people felt disillusioned with the political process altogether and were disconnected from it in a sense. I think individuals sense that there's so much more at stake this time than perhaps in any other point in their lifetime. And I can speak going all the way up to my grandparents. There's really a great deal of concern about what happens in November, especially with the White House, but also across these other states and municipalities where individuals have derelicted their duty in terms of providing safe cover to minorities and others in society.
And Mary, with Brexit, you referred to this a bit earlier on, but what do you think this COVID-19 and its effects, particularly on minority ethnic communities, would have on just the minority ethnic communities in the UK and its effects on Brexit, for example?
So in terms of what effects, Brexit's a done deal. So we left the European Union back in January. We had a year's grace period to negotiate a deal. I think the impact of COVID-19 on the whole Brexit process, I think it's going to be a no deal situation. I don't think it bodes well at all for Black and minority ethnic communities. I mean, even since the Brexit vote in June 2016, we've seen a lot of European nationals going back home, just not feeling safe. Like some of the vitriol that emerged just in the days following. was really unpleasant. But as I've said as well, these are things we've seen before. Those of us who grew up in the UK, this was commonplace in the 80s and 90s in a city, Britain. In terms of the impact on Black and minority ethnic communities, I think we're gonna see changes in how immigration works. Like, this has massive implications on the higher education sector, for example. The sector, this is another grossly underfunded sector, a sector that's reliant on international students, charging extortionate fees to international students. I'm not sure how that's going to work. In the next 2-3 years, I think the sector's going to have to rethink itself. And a lot of immigration, people settling here, when you remove the EU, a lot of that's coming from international students, like people who then go on to settle after here. The Conservative Party is just hostile to immigration. So in the last few years, we've seen changes on visa, Tier 4 visas, and then also changes on how long people can stay here after they graduate, things like that. I think Britain is very parochial at the moment. It's very inward looking. And I think it's only going to become more so. I think those of us who've been here for a while, who've been establishing ourselves, I think you're going to see more people emigrating, actually. I don't think, it doesn't feel safe to be in Britain at the moment at all. It hasn't felt safe for a few years now. And this is how I felt as a small child. There's been a lot of regression. I think we're going to see a lot of people leaving the UK. A lot of Black and minority ethnic, those who can they'll leave. But where are they going to go to? Look at what's happening in America. I know these are conversations I'm having with my circles at the moment. Like, where we're going to move. We just want to get out. We're talking about where we're going to go. None of us want to go to America. All over the world, you see similar things. The world is quite hostile to black people, ethnic minority people. The darker your skin is, the bigger a problem some people see you as. But these are conversations people are having. People are talking about leaving, about jumping ship. Just in terms of the way we're dying here at the moment as well, that's not helping things.
Any final words from you, Chavis, as we wrap up this somber but interesting discussion?
Yes, I would say that this is a moment in which we really need people, irrespective of your background, to really, really speak up on behalf of those who are most marginalized in your society. And what we're realizing from this very poignant and salient conversation is that across the pond, across the United States and across the UK, Black people are experiencing great levels of harm with regard to COVID-19 and with regard to systemic racism. And so I really believe that silence is the air that injustice breathes. And
Absolutely.
Despite the fact that we're wearing masks across America and across the world, injustice and racism in particular is breathing very easily. Mm-hmm. And so this is a moment where people have to speak out, whether you're Black or not, to say that this cannot continue in the way that it is. And once we leave quarantine across the globe, individuals have to have a heightened level of consciousness to the degree to which those in society who are most vulnerable are experiencing exacerbated levels of harm during crises like the ones in which we now exist. And so we need voices to speak up, and we need a chorus across countries to come together. And I appreciate you for bringing this together, Mary Jean, because it just really illuminates the degree to which these harms are taking place across continents and across nations. And so we really need heightened levels of consciousness for individuals to understand that these individuals are intersecting across the globe, and we're all in this together in an inextricable way. We're really connected in societies across the world as it relates to these issues.
Absolutely.
Mary, any final words from you?
My heart's heavy at the moment. I'm sad. I'm losing elders, like people who used to look after me when I was a child. Just lost a friend, a prominent Black musician. And to me, it just shows that people might think you're successful in this, that, and the other. But if you're coming from a background that's impoverished, the impact of that is long ranging. Basically, it has a very far reach. I think my last word would be: if you're Black, take care of yourself, basically, and take care of those around you who look like you. Look out for each other. That's what we have to do now. You know, no one else is looking out for us. Government's not looking out for us. Individuals who don't share our backgrounds are not looking out for us. We have to look out for each other. Yeah.
And we have it there, you know, COVID-19 has brought to bear many structural and systemic issues underlying society that even predate the virus itself, as we've just been discussing. And this is what the virus has shown, especially, and it's just been more exposed during this particular time of heightened pressure. Thanks, Mary and Chavis, for sharing your views in the discussion today. Like I said, but reflective, and I think gearing everybody up to some kind of positive action. And to everyone watching, thanks for watching.
Thank you so much.
Thank you.